Training video is offered by Compass HIN, a division of the Iowa Healthcare Collaborative, in conjunction with quality improvement staff from Telegen. My name is Ann Logus. I am a registered nurse and a senior quality improvement facilitator with extensive background and expertise in patient care and quality improvement. Prior to me joining Telegen, my responsibilities included fostering a culture of safety specific to care across the healthcare continuum. Sharps safety begins with culture. Part 2, prevention and management. The objectives for this presentation include highlighting the importance of a culture of safety, discussing organizational approaches to reduce the risk of Sharps injury, and a specific Sharps incident will be reviewed utilizing a root cause analysis tool. Work practices to prevent Sharps injuries are typically present as a list of specific practices to avoid, for example, recapping used needles, or use, such as Sharps disposable containers. Data show that the risk of a Sharps injury begins at the moment Sharps are first exposed and ends once Sharps are permanently removed from the exposure in the work environment. Therefore, to promote a safe work practices, healthcare personnel need to have an awareness of the risk of injury throughout the time Sharps are exposed and the importance of a culture of safety. Throughout this discussion, we will cover the culture of safety to address the Sharps safety continuum from an organizational view. An effective safety culture will have an impact by reducing Sharps injuries, by eliminating hazards, providing needleless IV access systems, engineering controls, and providing Sharps injury prevention devices. An effective safety culture will have an impact by promoting administrative controls. This includes policies limiting exposure to hazard, allocation of resources demonstrating a commitment to safety, establishing and supporting needle stick prevention committee, and consistent training on use of safe devices. An effective safety culture will have an impact by addressing work practice controls, such as recapping, placing Sharps containers at eye level, and emptying Sharps containers before they are full, and use of personal protective equipment. Some questions to think about. What does a culture of safety mean to you? How can you make an impact? If you experienced a Sharps injury today, do you know how to report it and the next steps to take? Do you think there is underreporting of Sharps injuries at your facility? Do you see Sharps incident as an opportunity to make an improvement? To make an impact and create a desirable culture of safety, organizations must address these factors known to influence employees' attitudes and behavior. Organizations must address known environmental hazards, and organizations must have a process to identify and address new hazards. Many strategies to reduce Sharps injuries focus on individual or job task level improvements, such as using appropriate safety devices. However, this session will focus on the broader organization perspective of safety, specifically the importance of a culture of safety where there is a shared commitment of management and employees to ensure the safety of the work environment. Management employees are partners in the reporting, learning, just, and flexible culture of the organization. And this partnership is key in the efforts to make improvements and prevent Sharps incidents and injuries. A culture of safety permeates all aspects of the work environment. It encourages every individual in an organization to project a level of awareness and accountability for safety. Employees perceive the presence of a culture of safety based on multiple factors, including actions taken by management to improve safety, worker participation in safety planning, availability of written safety guidelines and policies, availability of appropriate safety devices and protective equipment, influence of group norms regarding acceptable safety practices, and the socialization processes around safety that personnel experience when they first join an organization. All of these factors serve to communicate the organization's commitment to safety. To further your understanding, let's look at the culture of safety cornerstones. Reporting culture includes reporting and analysis of incidents. Properly reporting a sharps injury or incident requires that healthcare personnel are motivated to report, that they understand what to report, and know how to report it. In addition, the organization needs to have adequate incident reporting forms, either paper or electronic. And dedicated staff with the knowledge and time allocated to perform analysis of the report is a must. In an ideal reporting culture, staff should be motivated to report sharps incidents because they know the organization will follow through with the analysis and improvements necessary to make the environment safer for staff and for patients. Staff should understand what to report, and a good rule of thumb here is when in doubt, report it. The organization needs this input. Filling out a report should be seen as an employee's opportunity to be heard. Staff should know how to report, they need to know where to access the forms, and they need to submit them as soon as possible after an event. Organizations need to provide staff members that are designated to analyze sharps reports adequate time and training, along with a process to report up to the board and management, and then report back down to frontline staff. Reporting culture includes in-depth analysis of each individual event. For example, a root cause analysis, as we'll show you later in this presentation. Reporting culture includes compiled analysis of several incidents, as shown here in the cross-tabulation example. Without the frontline staff's input, there is no data for improvement activities. Their role is so important. The data they provide can be compiled to find common trends or causes, stimulating prevention and learning opportunities for the organization as a whole. The first step in this type of compiled analysis is to generate simple frequency lists by hand or computer on the variables that make up the following data elements: occupations of personnel reporting injuries, work locations where reported injuries occur, like the patient units or the operating room, types of devices involved in reported injuries, like hypodermic needles or suture needles, types of procedures during which injuries occur, like phlebotomy or giving an injection, timing of occurrence of injuries during use, after use, before disposal, specific time of day or shift, and circumstances of injuries, for example, during use of the device in a patient or while cleaning up after a procedure. Once frequencies are tabulated, a cross-tabulation of variables provides a more detailed picture of how injuries occur and can help identify a proposed problem, which can stimulate the need for a safety improvement project. Learning culture implies that an organization is able to learn from its mistakes and make changes. Perhaps the most obvious learning opportunity is teaching prevention of sharps injuries during the initial orientation and annual bloodborne pathogen training required by OSHA. However, there are many other opportunities, including staff training on the introduction of new devices and after each reported near miss or sharps injury reported at the organization. Some suggestions for content to include when providing learning opportunities. Adults learn best when they are provided with information relevant to their work. For that reason, to engage staff in learning, it's useful to share with them recent and common sharps injuries sustained at the facility. Share with them the compiled data as described on the previous slide. Share with them the process and outcome improvement process related to those reports. What were the root causes? What organizational practices were changed? Areas that might be described include a number of sharps injuries reported in the last year, occupations, devices, and procedures involved, and the most common ways injuries are occurring at the facility. Other information can include the hierarchy of controls and how this concept is applied in the facility. This includes strategies to reduce or eliminate the use of needles, like needle-free IV delivery systems, devices with engineered sharps, or injury prevention features that may have been considered or were implemented in the facility. Work practices that can be used to reduce injury risks, and whether any personal protective equipment is available to reduce injury, like Kevlar gloves for surgery or leather gloves for maintenance personnel, for example. And administrative activities designed to decrease sharps injuries, development of a sharps injury prevention team, changes or improvements in exposure reporting procedures, and safety culture initiatives. If the training is primary lecture, methods to make the training more interesting might include presentation of case studies of exposures, and at the end of the case presentation, the trainer might engage the audience in a discussion of how to prevent the injury, or facilitating a discussion of audience perceptions of sharp safety in the facility and suggestions for improvement. In addition, it's also important to ensure that staff know how and where to access procedure manuals, videos, or other resources that demonstrate the safe and approved techniques to be used at your facility. Just culture involves a blame-free environment where individuals are able to report errors or near misses without fear of reprimand or punishment. The framework of a just culture ensures balanced accountability for both the individuals and the organization responsible for designing and improving systems in the workplace. What do we mean by just culture? Traditionally, healthcare's culture has held individuals accountable for all errors or mishaps that befall patients under their care. But a just culture recognizes that individual practitioners should not be held accountable for system failings over which they have no control. A just culture recognizes many errors represent predictable interactions between human operators and the systems in which they work, and recognizes that competent professionals do make mistakes. A just culture acknowledges that even competent professionals will develop unhealthy norms or at-risk behaviors such as shortcuts and drift. Employees can be trained and coached and consoled to avoid human error and at-risk behaviors. But a just culture, however, has zero tolerance for reckless behavior, which is a behavioral choice to consciously disregard a substantial and unjustifiable risk. A culture of safety is flexible in the sense that decision-making processes vary depending on the incident, depending on the urgency of the decision, and the expertise of the people involved. A flexible culture is one where the organization and the people in it are capable of adapting effectively. Employees perceive the presence of culture of safety based on multiple factors, including management commitment to safety, healthcare personnel involvement in safety decisions, method of handling safety hazards in the work environment, feedback on safety improvements, and promotion of individual accountability. Management can also communicate a commitment to safety indirectly by modeling safe attitudes and practices. Healthcare professionals in positions of leadership can send important messages to subordinates when they handle sharp devices with care during procedures, take steps to protect coworkers from injury, properly disposing of sharps after use, and when they report sharps incidents, near misses, or participate in root cause, PDSA, or other improvement activities. Managers should address sharps hazards in a just, non-punitive manner as soon as they are observed and discuss safety concerns with their staff on a regular basis. This will positively reflect the organization's commitment to safety and build safety awareness among staff. Involving personnel from various areas and disciplines while planning and implementing activities improves the culture of safety and is essential to the success of such an initiative. Those personnel who participate on committees or teams created to institutionalize safety serve as conduits of information from and to their various work sites. They also legitimize the importance of the initiative in the eyes of their peers. You are part of the prevention process when you adhere to safe practices and assist and support your coworkers in safer practices. Report injuries and exposures to blood or body fluids, sharps injury hazards, and near misses. Engage in training for devices and properly use sharp safety features. If additional training for staff is needed, request that the vendor be asked to come back to provide training. Participate in surveys and device evaluations. If you have not been involved in the selection process or involved in piloting devices, ask how that process works. Find out how you can provide written feedback on the use of new devices. The process of selecting engineered sharps injury prevention devices gives healthcare organizations a systemic way to determine and document which devices will best meet their needs. The selected devices must be acceptable for clinical care and provide optimal protection against injuries. The selection process includes collecting information that will allow the organization to make informed decisions about which devices to implement. Listed here are key steps to the product evaluation process. Healthcare personnel who know that management will discuss problems in an open and blame-free manner are more likely to report hazards. But surveys of healthcare personnel indicate that 50% or more do not report injuries. Healthcare organizations can also actively look for sharps injury hazards by performing observational rounds and encouraging staff to report near misses and observed hazards in the workplace. Organizations can survey staff to determine if they are motivated to report, understand what to report, and know how to report it, as they look for more reasons why there may be underreporting. A number of communication strategies can provide timely information and feedback on the status of sharps injury prevention in the organization. One strategy incorporates findings from hazard investigations, ongoing problems with sharps injuries, and prevention improvements into articles in the organization's newsletter, staff huddles or meetings, and electronic communication tools. It's important to communicate the value of safety by providing feedback when the problem is observed and request feedback. Another strategy is to create brochures and posters that enhance safety awareness. Such materials can reinforce prevention messages and highlight management's commitment to safety. Promoting individual accountability for safety communicates a strong message about the organization's commitment to a safe healthcare environment. In order for accountability to be an effective tool, all levels of the organization must comply. An organization can promote individual accountability for safe practices in general and sharps injury prevention in particular in many ways. One way is to incorporate an assessment of safety compliance practices in annual performance evaluations. For managers and supervisors, this might include evaluating methods used to communicate safety concerns to their subordinates. Organizations might also consider having staff sign a pledge to promote safe healthcare environment. This could be incorporated into hiring procedures and are part of an organization-wide safety campaign. Successful injury prevention programs require comprehensive reporting of injuries, meticulous follow-up, thorough education in the use of new devices, and accurate evaluation of safety device and program effectiveness. But experts also agree that safety devices and work practices alone will not prevent all sharps injuries. Significant declines in sharps injuries also require education, a reduction in the use of invasive procedures, a secure work environment, and an adequate staff to patient ratio. Moving now to our case study, a root cause analysis tool uses a structured team process that assists in identifying underlying factors or causes of an event, such as an adverse event or near miss. Understanding the contributing factors or causes of a system failure can help develop actions that sustain corrections. The 5 whys is a simple problem-solving technique that helps to get to the root of a problem quickly. The 5 whys strategy involves looking at any problem and drilling down by asking why or what caused this problem. Typically, the answer to the first why should prompt another why, and the answer to the second why will prompt another, and so on, hence the name 5 whys. This technique can help you determine the root cause of a problem. Let's explore a sharps needle stick case example. As soon as the patient is properly cared for, the staff member's injury is stable, and the facility's procedures have been followed, the quality improvement process can begin. The 5 whys should be completed at the site of the incident by staff members involved and can be facilitated by a staff member with skill in the 5 why process. In this scenario, an employee has just sustained a needle stick in a patient room. The facilitator can use the answers to prompt the next why. For example, the facilitator can start by what occurred, and the answer given: while in a patient room, I was inserting an IV and the needle punctured my finger. The facilitator can then ask why. Why did the needle puncture your finger? The answer: the needle punctured my finger because I was moving supplies near the needle. The next question: why were you moving supplies? And the answer given: I was moving supplies and looking for tape to secure the catheter. I then realized I did not bring tape to the procedure area. The next why no tape in the procedure area? And the answer: because I was getting supplies, there were no IV kits stocked in the patient room, so I gathered individual supplies. I did not gather tape. There was no tape in the patient room supply. The next why no IV kits or tape? And the answer: maybe supplies in patient room are not restocked properly with tape. Supplies I need are often not stocked in patient rooms. I frequently leave the room to get supplies. The next why are needle supplies not stocked in patient rooms? And the answer given: I do not know the standard list of items, and I have not communicated my need for certain items to be placed in patient rooms. At this moment in the 5 why process, you can see that a proposed problem or problems have been identified. In this case, the potential problem is the supplies needed to perform procedures that involve risk of sharps injury are not available in the patient room. At first, completing the 5 why can be tricky or may lead to different potential problems. The important thing here to remember is that your 5 why skills will improve over time. So get started and try it at your next incident. This case demonstrates that the employee that experienced the needle stick has valuable knowledge to share and is key in the problem-solving process. Anytime an employee completes a 5 why or similar tool, they should be thanked and recognized by management in some way. The next step in this example is to determine if a full-blown PDSA or Plan, Do, Study, Act cycle is justified. You do not want to utilize resources if the potential problem is not an actual risk or if nothing can be done to reduce the risk. A PDSA survey can identify more details from more staff about the proposed problem. Is the risk common, experienced by many, worthy of testing? Using information from the 5 why survey questions can be developed by the safety committee or quality personnel. For example, here is a survey developed from our 5 why example. The anonymous questionnaire can include questions such as, do you feel the procedure, supplies, and patient rooms are stocked in the most optimal way? Or are they stocked 100% of the time? Do you ever feel that others may be at risk too? Or do you often have to do you often have to leave the patient's room to collect supplies? Make sure to leave areas for staff to leave comments. Again, the PDSA survey demonstrates the important role of employees and frontline staff, offering that valuable knowledge that only they know and can share. And again, they should be thanked and recognized by management in some way. The safety committee or quality professional can review the results of the survey, and if the results indicate the proposed problem is significant, the next step can be to complete a PDSA cycle to test a potential fix. Survey results are likely to assist in narrowing down the type of test or study to perform, or may direct your attention to a previously unknown area of concern. In the case example, the survey was administered, which provided a baseline. The supplies in the patient rooms were reorganized. Then staff worked in a testing environment for a designated time frame, and then the survey was administered once again to provide a comparison for your study. The aim was to prevent Sharps injury in patient room. And the plan is to see if providing certain supplies closer to the point of care will help staff feel safer. The prediction is to show having certain supplies in the inpatient room will make the patient room safer and prevent Sharps injury. The do, or what did the data show when the test was carried out? The overall data showed that staff made less trips in and out of the patient rooms, and the staff feel patient rooms are stocked in a way that decreases risk of Sharps injury. In addition, 0 Sharps injuries occurred during the testing period. The team also learned that the staff that stock supply room and patient rooms need to understand how important their role is and how their work has an impact on patient and employee safety. These staff members should be recognized for this or trained to see the importance of their work. In the study section, how did the results of the test compare with the prediction? The test and pre and post survey show that moving certain supplies into each patient room will make staff feel safer and prevent Sharps injury. The act, or how might the test be redone in light of what was learned? The team learned that they would like to test a list of supplies and kits and analyze which, how many, and how to organize supplies in the safest manner. The team would also like to determine which supplies are the most optimal for safety. The team would like to understand the steps necessary to restock supplies so they are available 24/7. In addition, the team would like to consider facility-wide prevention of Sharps injury by testing other areas of the facility for optimal supplies. The next step here is communicating results to management and administration. The documents we reviewed can assist in this task. It's important to note that what may be optimal for safety may not be optimal for cost or space. Maybe the reorganizing of supplies with Sharps safety in mind will require new cabinets or other expenses. But by communicating your PDSA results clearly, administration can determine how to allocate resources and move forward with your safety recommendations. Likewise, these decisions need to be communicated back to the staff involved. This closes the communication circle, demonstrates a desired culture of safety, and shows how employees and management are partners in the improvement process of an organization. An example from earlier, instead of using the 5 why to identify a proposed problem, the compiled analysis in the cross-tabulation can also pinpoint a proposed problem. Here, a high risk of sharps injury has been identified for physicians when using the winged steel needle. You could prepare a PDSA survey for the physicians to gauge their input on this specific needle, and then follow up with the PDSA project if warranted, with an aim to target sharp safety for physicians and use of this specific needle. Here are some additional resources focused specifically on sharps injury and prevention and improvement. As we wrap up this session, you should be able to speak to each of these key points. The achievement of an effective safety culture is a vital element in achieving and maintaining safety performance. Congratulations on your successful completion of today's session, and thank you for participating in this education opportunity sponsored by Compass Hin.